Depression is a condition affecting folks where they feel persistently sad or unhappy, lasting several weeks or more, that affects their activities of daily living and just the way that they live their life. For those of you who are uncertain whether or not you have depression, there are certain indicators that you may want to take a look at. One of them may be the feeling of sadness or being unhappy most days than not, even some irritability. Other symptoms include anxiety, tension, and uneasiness, an inability to rest, problems sleeping or problems with your appetite. Other things include lack of energy or lack of motivation. Also, things that you used to enjoy, you may not be enjoying those as much anymore. You may also have feelings of guilt or self-doubt, blaming yourself for things. And in the most severe instances, sometimes you may have feelings of hopelessness or helplessness, even with thoughts of suicide at times. There are typically two groups of people that seek out treatment at CNS Healthcare. One is the individual who may not be sure that they have depression and they're looking for answers. And the other are those folks who have tried multiple antidepressants or who are on an antidepressant and are not satisfied with their current treatment. They're hopeful that maybe the new clinical research trials may offer them a chance for improvement where they haven't had any before. One of the patients that I had been taking care of here at CNS Healthcare was a young lady in her 20s, and she stopped attending college because of the symptoms of her depression. She just wasn't able to concentrate on her schoolwork. She was not motivated. She just felt generally unhappy and wasn't sleeping very well. And she had tried medication like Prozac in the past, and it really didn't help her to the degree that she needed. And as a result of these symptoms, she dropped out of school. She wasn't able to look for a job, even though financially her family really needed her to do that. So she came in and wanted to participate in a clinical trial, and while she was taking her medication for depression, we were able to enroll her in a trial where she could add something into her depression medication that would augment the effect. After 6 weeks in the clinical study, she was feeling much better. She was able to get a job, and she's been able to maintain that job now for 6 months, and she's looking to enroll back in school in the summer.